Hello, everybody. I think we'll start by we'll get started now. I'd like to welcome everybody to CACBT's inaugural webinar. I'm the president of CACBT. I'm the I'm just going to take a couple of minutes to talk about this endeavor and introduce our host, Dr. Christine Korol. So this is very exciting. This is the first time that we've ever held a webinar. We've had over 300 people, or we've had 300 people register for this webinar, and it's full. And it's a mixture of people from all across the country. We have people signed up from BC all the way over to Newfoundland. Hopefully everybody's got their time zones correct. I tried to keep that in the message. For those, we've got certified members from CACBT, members of CACBT, student members of CACBT, and we have a whole bunch of non-members of CACBT. So for those non-members, welcome. We hope that you will become members eventually. For those of you who don't know about CACBT, we're a Canadian organization that focuses on the dissemination, training opportunities and certification of cognitive behavior therapists. We hold an annual conference every year, though this year we won't be unfortunately holding this conference, which is why we're holding these webinars this year. It's a wonderful organization. We're really thrilled that the support of our membership was able to pay to have this this free webinar during this unusual circumstance that we're all in. So I hope that if you're a non-member, you've learned about us, and you will go to our website, cacbt.ca, and look into our membership. We have conferences, we offer certification in CBT. We're working hard to try to develop public dissemination strategies for CACBT. We hold training through our conferences, and now we're holding training online. So now I'm going to introduce our speaker. So we felt that given the current circumstances, many of us are doing CBT in person, and we're not used to doing it online. So we thought that it would be of great value to provide some training for people as they're trying to get their private practices up and running. There's a huge need right now for additional support because there's a lot of people who are anxious. There's a lot of people who are going to go through a lot of social isolation as this time. So people need extra mental health support right now. So we thought that it would be an excellent training opportunity to bring this. So we're very thrilled to have Dr. Christine Korol come and speak to us. She is the director of the Vancouver Anxiety Center. She's a certified CACBT member, and she's an adjunct professor at the University of British Columbia. She has expertise in adopting therapy for online uses. She spearheaded the development and was a program lead at Kelty's Keys, an online therapy service at Vancouver Coastal Health. So we're very, very thrilled that she agreed to give this at such short notice. So thank you so much from CACBT. We think this is a wonderful opportunity. So I'm going to pass it over to Christine. Just a couple of CPA CE credits. If you need a CPA CE credit, please do sign in on the chat window. All we need is for you to sign in at the beginning, just with your name, your first and last name. And at the end, please do sign out so we know that you've attended the entire webinar. We're going to keep you on mute so that we don't hear lots of background information or background sounds that might happen. If you have a question to post it in the chat forum. We have Leanne Kane, who's somewhere in this big long list of faces, who will be directing the questions to Christine to answer. So there'll be opportunities to ask questions too. So hopefully this all runs smoothly, and I'm going to pass it over to Christine.
Great, thank you. And then Andrea, do they have to be CACBT members to get the CE credits?
No, they don't need to be.
Oh, okay.
They just, CACBT members had first opportunity to sign up.
Okay, that's awesome. That's great. So everyone should consider joining because they're awesome. If CACBT is great if you're not already a member. So I'm happy to help out today. So I'm really excited about this particular webinar because I usually, when I help other therapists get online, I've been running workshops. Some of you may have taken the workshop I did for the College of Ontario Psychologists a few years ago. I've done it, getting started for in Alberta for PAA and here in BC. So I've trained, I think, thousands of therapists now on how to start their online therapy practices. So what I'm kind of curious about, I don't know if people can type in the comments whether they've seen the YouTube video that I did about a week and a half ago on ethics, tech, and practice. So if you haven't, I'm not going to overlap a lot with what I covered in that workshop. Okay, so I'm seeing a lot of no's. Okay, so you can search for me, my channel on YouTube. And about a week and a half ago, there's a day-long intro to online therapy workshop that I've given, and I just updated with sort of newer information in light of COVID-19. And it's about 2.5 hours worth of video. And the middle one, actually, it's me and my husband talking because he works in tech. So that will have a lot of the basics about how to set up your system, how to decide what technology you want to use, some of the ethical issues, talking about your informed consent and what should be in the informed consent, and a whole bunch of other issues. So it's kind of a crash course in how to do that. So I'm very conscious about not covering what I covered there, and we're going to focus more on the practice of online therapy. And in this particular workshop, the practice of using video and sometimes phone in your online therapy. Some of you may have already taken, I do a lot of email CBT or iCBT, and that involves emailing your client back and forth. It's asynchronous therapy. I'm not going to talk as much about that, but some of you may have attended my workshops on how to write therapeutic emails. So, but I thought today, like, everybody's trying to get up to speed with video, and most of you, how many, if you put in the comments, how many of you have started doing, quite a bit of video already? Have you transitioned in the last couple of weeks? So if you type that in the comments, I'll have a look. Just getting ready to start. Okay, so what you can do throughout this, Leanne will read questions to me, and I'll also be checking, because I think when I switch to sharing my screen, I'll still be able to see all the comments, but if not, I'll ask Leanne to read me questions. So ask your questions as we go, because I'll pause for questions when we're at every slide or two, just to see. And then maybe at the end, if there's some room. I know when I've been running these, I've been running these webinars for a few different counseling organizations since this has all started. People have a lot of questions, so I want to give some time to be able to answer some of those too. So perhaps if we, just because of the number of people on the call, we're going to start with most of the talk with the chat questions. But if we have some room at the end, maybe if you're brave enough, you can pop on video. Oh, and then Andrea just put a link to my videos on the technical side can be found on the resource section of the CACBT website. Okay, so I'm going to share my screen here, take you to the slideshow. All right, so a lot of people are really quickly getting up to speed, and I thought I'd start by talking about what exactly is online CBT. How are some of the ways that we do it? And it can be any number of ways that you connect remotely with your clients. So it's distance therapy, essentially. And I think I've done all of these that I have listed up here. So it can be synchronous, meaning that you're having a live session with your client, even live texting your client back and forth. or it can be asynchronous, where you're sending messages back and forth to each other, either on a platform designed to do that or using secure encrypted email. So people are often surprised. If you go searching in the literature for this too, if you want to do a more in-depth search for the kind of work that you do, like if you wanted to see like online CBT for obsessive compulsive disorder or hoarding, if you wanted to go to search for articles, you're going to find that there's a lot of different names that it's known by. So, you know, everything from telehealth, teletherapy, telebehavioral health, online therapy, distance therapy. There's also iCBT, if you want to go specifically CBT. So all of these really involve some component of working remotely with your clients. And I'm also going to include, I'm going to talk a wee bit about computerized self-help. A lot of therapists too, when they hear online CBT, start to worry that it means we're going to lose jobs and that people can just work on, you know, basically a computerized self-help program or an app. The research really shows that you need a therapist to help you. But those programs can be nice adjuncts to therapy. And I often get people working on things in between sessions using some of that. And then I'm also going to add a little bit at the end about doing online CBT education and spreading the word about how CBT works and what people might learn. Okay, and I can't see the chat when I'm in this mode, so I do actually need, can I see the chat here? No. Oh, there we go. And I just messed this up. So welcome to my first Flub. Let me start sharing the screen again. Okay. Okay, sorry about that. So Leanne, are there any questions so far?
No questions so far. I did have someone that I know ask me if some chat functions are disabled currently.
Oh, okay. Are people having trouble on the chat?
Yes, my chat was disabled.
Disabled too.
Disabled too.
Oh, maybe that's why I can't see it.
I was able to message this person personally, but I wasn't able to, she wasn't able to respond back to me.
Yeah, mine is disabled completely.
Mine is as well.
Okay.
Mine is also disabled.
Mine is disabled as well.
Oh, no.
Okay, so we have a few people for that.
Yeah, mine is too.
Yes.
Mine is also disabled.
Okay.
The same here.
How about now?
Mine's back enabled.
There we go.
Yeah.
Mine.
Okay. It was something got switched.
Perfect.
So I switched it back on. Okay, we're back online. Oh no, well, that's where all the questions went. So any questions now since we paused? So we talked a little bit about like working on video, who's worked on video, and any questions about the different kinds. Oh, so a lot of people say it's to, here, I'm going to switch it to everyone publicly. So no private messages, because so I'm getting all these private messages now. There we go. So working on video and phone now, done video and phone. Has anybody noticed anything, any observations or assumptions about working online or in phone after this first week or so? Won't be the same emotional connection. Found it more difficult for the initial appointment. Not so comfortable for my clients. Not everyone has a private space. We need more focus. Many clients don't want to do online. How do you assess if someone's suitable for telehealth? Oh, that's a good question, especially adolescents. Yeah, so a lot of people finding that clients are reticent, that they also need good internet access, and giving handouts. Okay, so we'll talk a little bit about that too. And one loving it. Okay, so I'm gonna go back to the slides here. And sharing the screen. All right. All right, so what I thought I would do is talk about therapists' beliefs, because that's the first stage to working in online therapy, and particularly video therapy, about how, well, one of the therapists' beliefs, because I've done a lot of change management basically with therapists and trying to get them on board. The Mental Health Commission of Canada was finding that this is one of the main reasons why distance therapy was really not moving along as fast as it could be, even though it's really helpful for patients, because there is a lot of resistance to it initially, and people thinking that it can't be as effective as face-to-face therapy. So we're going to go through a few things that we hear. Yeah, and then Mental Health Commission of Canada actually even put out a call for proposals for people who had research projects on how to increase the acceptability of online therapy to clinicians. So now we have no choice. So it's going to be a crash course for a lot of people, and there's a lot of anxiety about moving to this modality. I can say I've been doing video sessions, and most of us have done phone sessions, but I've done video sessions probably now for a good 15 years, almost as soon as I could get my hands on a video platform. And the first time was in a hospital setting, and the patient I was working with had to go to a clinic in their community, which was remote, and then I would be meeting with them via the hospital video link. So this was in the days before we had Zoom and other secure telehealth options. And I would say the telehealth options have actually really improved in the last 5 years. And we're going to see a huge change in the next 5 to 10 years in terms of the sorts of things that are available. I think this experience that we're all going through is going to speed up innovation because more and more therapists are going to develop comfort with this. But the number one thing that I would hear when, I've had different tech initiatives, I've tried different tech initiatives at different hospitals that I've worked with. Now I'm working more in the private sector. But, the main thing I'd hear from clinicians is it's just not going to be the same. It's not going to be effective. But there's not a lot of evidence to support that if we do a thought record on that. What we do know is that there is a large body of telehealth research, even as far as 30 years ago, looking at how effective CBT can be when you connect with people, particularly in rural and remote areas. And now it's becoming more common as a regular option. So we do surprisingly have a large database of research showing us the efficacy of almost any program. So it's getting to the point now where we see if CBT works in a face-to-face setting, it's most likely going to work online. And you can go and search and find there's so many people who love this stuff that have been doing the research. And then the other thing about doing online therapy research is it's easier to collect the data because the assessment, the outcome questionnaires are online. And I think that's helped research in this area. It reduces some of the measurement issues. So it's quite easy to set up a study and collect that data. And then the other thing that I hear, sometimes people worry that administrators or other people are going to want to shut down the number of therapists that they hire, that computers will replace therapists. But what we're seeing from the research is that a self-guided app or computer program just isn't as effective as trying to do it with a therapist. People really do need a therapist coaching them and guiding them. I often say that trying to do CBT from a self-help book or an app is kind of like trying to learn ballroom dancing on your own. You do need a coach or someone telling you that you're doing, even if it's just to tell you that you're doing it right, and to adjust your expectations for where you should be at when you're learning these things. We really do need therapists who can do that for us. So any questions or reactions there? When I'm in the screen, I definitely can't see the chat. I'm wondering if the screen session disables it.
No questions yet.
No questions in the chat?
No.
Is the chat disabled?
No, it's going. We do have one question. Will the slides be available somewhere?
Yes, I think so.
Or at least in the recording, I guess would be the
Yeah, I mean, I'm happy to share them. I'm going to set up a website probably this weekend, and I can put them up there. A lot of people have been asking me for the YouTube slides as well. So my contact is Christine@therapythinktank.com. And so that email is working, but the therapythinktank.com website is going to be built, a skeleton anyway, this weekend. It was supposed to be a summer project that's been moved up. And I can certainly send them to you, Andrea, if you want to disseminate them to the list. There's not too many slides, so it should be easier to send, whereas my other one is so huge. It's hard to email. I have to break it up, but this one's, I'm trying to do more discussion and talk with this one, so you shouldn't be too overwhelmed with how many slides. And depending on the kind of device too, you can also take a screenshot.
We're happy to share. We're hoping to put this up online after as well. So anybody who wants to rewatch will be able to rewatch, provided recording goes well. And if you want to put the slides there or have us put a link to the slides, we're happy to do that as well, Christine.
Okay, great. Yeah, no, I'm happy to share. Okay. So next, the other thing that I hear from a lot of therapists is worrying about the technology and feeling like they're not very techy and that it's going to be hard to learn. And so one of the things that I do is want to encourage people that you absolutely can do this. You got through grad school, but it is when you read a lot of the books out there about online therapy and getting up to speed. One of the things that one sort of checklist of, are you suitable for online therapy that I liked was, are you afraid of online banking? And if you're afraid of online banking, you might be a little bit nervous doing online therapy and have trouble with encryption. So I thought that was sort of a good self-assessment in terms of your comfort with technology. Online banking is pretty secure. They don't want to lose money, but there's always some risk. But if you have that comfort with it, then you're probably going to be comfortable with online therapy. If you have difficulty using a telephone for some reason, you do need that as backup. Sometimes the video link doesn't work. Everybody's on Zoom these days. I had Zoom work all day for me, and my last session yesterday, it just petered out, so we had to go to phone. So even if you're using video so that you have those visual cues in therapy, if you have difficulty using phone as a backup and it's hard for you to work without the visual cues, I find telephone works quite well. I think most of us have done a crisis call, so most of us should be okay there, but there's different reasons where that might be difficult. Or if you don't use a computer at all, you're not sure how to update your computer, keep your devices safe. A lot of that's covered in so I go into this in a lot more detail in my tech talk that I have on YouTube. But, the evidence that does not support the belief, that, most of us are going to be quite comfortable using the technology once we get started is, most of us got through grad school, we passed stats, which maybe wasn't our favorite subject. But when we sat down, we learned to do it. I think there's a lot of technology. There's a lot of jargon used in technology that you don't need to worry about. And if you're comfortable sending emails, if you have some comfort driving a car without understanding how it works, I don't know how a car works, but I feel comfortable driving it around. And so and the other important piece is that you set up networks with each other so that you can talk to each other about these issues, whether, well, now it'll have to be online of some sort, but doing peer consultation and starting groups with each other so that you can talk about things that you're noticing or settings that you tweak if you're using the same platform. Really sharing right now and getting up to speed together so you're not doing this in isolation is really important. So it's great that CACBT organized this event for all of us so that we can start doing that, and you can get some comfort, you know, doing Zoom meetings where you get a group of therapists together to talk about where you're having problems, where you're having concerns. It's nice not to feel alone doing this too. I think the other thing that the therapist groups are helpful for is just talking about workflow. Here in BC, we have a Facebook group of private practitioners that chat together, and you know, there's been some great questions on there and discussion about, you know, just how tiring the first week was, and everybody's like, oh, this is so exhausting doing this. And I, you know, at any given time, about 25% of my sessions each week are video. So I always seem to have a lot of distance sessions, but going from 25% to 100% video therapy was a real change in my workflow. So I found I was quite tired last week, and now it's adjusting a little bit. So we were able to talk about that it's not just the video therapy making you tired, it's figuring out how to let everybody know how to join meetings, and how are you writing emails to people, or are you calling people? And so workflow issues have changed a lot, but knowing you're not alone in that, you know, and checking in with your colleagues is really important, and one of the advantages of technology. So I would encourage all of you to reach out and share your tech fears with each other, or problems or wins. If you figured out something, you know, that works really well, to share that with your colleagues too. Because there's very few programs that have integrated video where they handle a lot of the workflow with you. Jane app just recently added video. I'm still using my Healthcare for Zoom account with sessions for the meantime, even though I use Jane. So I haven't played around with it much, but all those sorts of things, you know, it's nice to have a group that's using different platforms as well as the same platform so that you can work that out. So we're all in this together. But, you know, one definition of technology I really like is that technology is anything that is, you know, new in your lifetime. So, you know, the telephone was invented before I was born, so it's really not technology to me. So technology is anything new that you have to adapt to and learn how to use effectively. And so when we think of technology, so we don't think of the phone really as being a technology. The filing cabinet was technology at the time it was invented. There was nothing like that to organize papers. And so, but as, you know, it becomes integrated, we don't think about it anymore. So here's a new thing that we're all adapting to and all learning how to use. So we need to share our experience doing that. So any questions about that, about tech fears or?
Yeah, so we have some questions about confidentiality regarding different platforms. So we have some people wondering about specific online platforms and whether they're encrypted and safe for us to use for therapy.
Yeah, everybody asks me that question. What should I use? And the problem is that platforms often change. You know, news will come out, they'll get bought by one, like they'll be safe one day, and then they'll be bought by another company another day. So I actually talk about that in great detail in the second YouTube video, the part 2 of setting your tech up. And so what I teach people instead is how to do an evaluation of the software that you're using and how to tell where the data is being stored and are they using proper encryption. And then you have to keep checking over and over again, you know, and I've been using, say, Zoom for Healthcare right now. That may change. You know, people will say to me, oh, 10 years ago, you said you were using this. And I'm like, yeah, but I dropped it, you know, 8 years ago. So I'll tend to change a lot based on my evaluations. And So I talk about like where to find reviews, where to find safety issues. You know, now we're hearing a lot of complaints. Zoom is getting sued for giving information to Facebook, because you can log in using your Facebook ID, and then I guess that gives some information. So I don't know how that applies to the healthcare versions of the accounts. You know, one of the reasons why I wanted the healthcare version is if there are any big breaches, there are big fines for that in the US. So that's an added layer of protection that Zoom is going to have to pay fines if they actually did breach health information, at least in the US. So I haven't read the whole article about what's going on there. So having a good understanding of technology can help you sort of be critical when you read through the news articles that come up about different platforms and different settings. So there was another one about Zoom that came up about privacy concerns. And that was really, a lot of people don't realize that their boss can read the chats after the Zoom meeting, even the private messages to other members, which, you know, most of us know our bosses can read our work emails, and it's no different with Zoom. So when you're doing one-on-one therapy with somebody, that's less of an issue in the healthcare account, and they set different settings. So I was fielding a lot of questions about that. A lot of people panicked when they saw just the headline, Zoom privacy breaches, or concerns about Zoom's privacy. And when I read the article, it was actually, well, no, that's like in big group meetings where a boss is looking in. So, you know, employees need to be mindful that bosses can usually see what we write. It all gets stored at work. Any other questions?
Yeah, so we have another one about online therapy and license portability across provinces and the US-Canadian border.
Mm-hmm. So you have to be wary. So if a jurisdiction has no Psychologists Act or any regulations around therapy, then you can offer your services there. So you have to do some digging. So for example, the Yukon doesn't have a Psychologists Act. So usually psychologists up there are registered in another province. So they have some connected to some regulatory body, but but you can offer telehealth services to that region. Now there's cautions for not doing that, like if you don't know community resources, and I think there's a lot of good reasons, and I talk a bit about that in the ethics one, but it's a good idea. The other thing is, though, some states and provinces are cracking down on therapists offering services outside of their jurisdiction. So that's a big issue too. So if there is any regulation in a particular state or province or country, and you offer services there, you can get in trouble from that jurisdiction for, you know, providing unregulated therapy. So you have to check with the regulatory bodies in the jurisdiction that you want, and some will give you permission. You know, especially in light of COVID-19, there seems to be some loosening of boundaries but it's not across the board. So if you have a client in a particular state or province, you need to call their regulators and see if you're allowed to provide telehealth to them. Any other questions?
That's it for now. Thank you.
Okay. So let's go to the next one. Now, this is the other big one that I hear a lot. My clients prefer face-to-face CBT. I think especially having so many people have to do this right away, and that people are unsure that it's going to, whether or not it's going to work. One of the things that you might do is provide a 15-minute discovery session to your clients to see how they think it would be. What I've been doing over the years, though, if I've had a client who's like forgotten an appointment, or they're not sure they're going to make it on time, when I call them, I'll say, well, do you want to jump on a call or Zoom session? Rather than me charging you a no-show fee, we may as well try that. And then after they do it, they're like, oh my God, that was really good. They're surprised how well it can work. So and then the other thing that seems to be important is the therapist's confidence in selling it to your clients. If you're feeling ambivalent about it, if you think it's not going to be as good, that's going to be conveyed in how you explain that to your clients. So you have to have, it's good that I think that's why it's good for therapists to read and learn a little bit more about the efficacy of therapy online, whether it's phone, video, or even asynchronous email, it works. And it can help people, it's as effective as face-to-face therapy in most situations. There's been a few studies of ICBT or email therapy where people actually continue to improve at a greater rate than people with face-to-face therapy. And I think part of that is that they get used to doing more of the homework on their own and trusting that they can do it. But I don't think that they've looked at mechanisms yet for that. But it's quite exciting, you know, how we can offer alternative approaches to therapy. You know, we've really been stuck in face-to-face for a long time. And that's what most therapists are comfortable with. But most people don't have access to good CBT. So, you know, if we want to spread the word and help more people, then getting creative about the ways of reaching people is extremely important. So I think if you just even dip your toe a little bit into the research, that can help with some of the ambivalence or worries that you might have about that connection. You know, and the other thing that the legitimate reason why some clients might be reluctant to do online therapy is the lack of privacy at home. This is particularly an issue in Vancouver, where we all have small Vancouver apartments. So right now, this is actually, I'm using a Zoom background. You can't see my laundry baskets that are really behind me in this frame. So I'm sitting in a corner of my apartment bedroom where I know it's not good for CBTI. I do a lot of insomnia treatment. I know you're not supposed to work in your bedroom, but I sleep okay. So, and have my back turned to my bed. And but this is actually a picture from my office. This is the view from my private practice office in Vancouver. So when clients jump on a call with me, they're like, "Oh, are you in your office?" I'm like, no, we're just going to pretend we're in my office. And so, you know, I've seen people have told me that they've set up calls in their laundry room, or clients have gone to their car to do the session. But that can be a challenge. But people are starting to work it out, and we'll see as time goes on if people come up with really creative solutions about how they can connect with you. And then a lot of clients worry that it's not as effective. So on my website, you can even have a look if anybody's curious. You can go to my vancouveranxiety.com website, and I've got some copy up there now talking about, you know, we're now offering telehealth and it's just as effective. I forget exactly what I wrote, but, you know, feel free to steal that and make it your own so Google doesn't penalize your SEO on your website. But you can feel free to steal and edit the copy as you want. I'm going to be probably updating my website a lot as this goes on and things change, and play around with different offerings for clients too. So the one thing though about once you can get a client to sort of buy in to just trying online therapy, if you can even get that 15-minute discovery session for free, I wouldn't start discounting my rates just yet. I know a lot of people have told me they're tempted to do that. I would start with a free 15-minute test call and see how people like it. And they're often surprised. And the research really does show that there's very high rates of client satisfaction with distance therapy. I mean, one, it's so convenient, you know, not having to drive and go to an extra appointment. I noticed that somebody said it was harder with teens. I think it varies with teens. I think you get something called the online over-disclosure effect. And so if you have a non-communicative team, sometimes I treat teens. I've had a lot of really good sessions with them this week. maybe because it's also no other contact, right? That and so, you know, there's a chance to talk to somebody and they're talking with their friends more on Zoom and other channels, but they're more comfortable at home and tend to talk more. But yeah, we see high rates of client satisfaction, high rates of therapeutic alliance. It's just as high as face-to-face therapy. It's convenient. And, you know, the other nice thing about this, when this is all over, you maybe would consider continuing to serve your entire jurisdiction, your entire province that you are registered in, and help all those rural and remote clients. You know, when I first started really doing a lot of video therapy, it was when I was living in Alberta. And, you know, and when a snowstorm would hit, I would suggest to people that we would go on a video link, and it became a great way. And we had some bad winters when I was there where people could just, I couldn't even get to my office sometimes. So it was a nice option for when you're a bit snowbound and you can't get to your therapy appointment. But yeah, if you can get people just a taste, often that reassures them that it works quite well. And then I always ask at the end of my video sessions, what did you think of the video? How was that? You know, if it's their first video session. And most people will be, well, I would say like most in my informal surveys are like, yeah, actually that was really good. I was kind of surprised. That worked well. And, you know, and a few people are like, well, I like coming into your office and seeing you. And I'll say, yeah, I miss that too. I kind of am missing my office a little bit, but, you know, ask them and check with them and see how they're doing. And if there's anything that can be done to make it a little bit more comfortable or better for them. So there is more of an onboarding process, getting people, because it's such a new way of doing therapy. Okay. Any questions there?
Yeah, a couple. So someone was wondering if you could share some literature on the efficacy and satisfaction of online CBT or teletherapy. I don't know if that's included in the references somewhere.
I don't think I put them in the references, but I can put that up on Therapy Think Tank. You know, I think one of our Canadian researchers, Heather Hadjisteropoulos at the University of Regina, has shown that in a number of her studies as well. She does more ICBT research with the email, but there's lots of that. If you go to Google Scholar, it's not hard to find, you know, satisfaction online therapy. But I can put a few key references up. Maybe I'll go looking for ones that are in the public domain, like or that are open access, and then I can add that in the next few days.
Okay. And someone else had a question about being able to utilize play and toys in games, especially with younger children through teletherapy.
Yeah, for teletherapy, I'm gonna actually talk about that a little bit later on. I tend to stick more to parenting rather than play therapy with smaller kids online. So, you know, if they can talk with me and work with me a little bit, I find actually with kids, you know, under 8, I'm mostly working on parenting right now with people. And then 8 to 12, it's half, you know, a little bit of CBT, coloring or drawing or exercise. I get them to have some paper. And then teenagers, it's one-on-one with them mostly right now. But yeah, I'm not, you will have to change a few things. You could certainly watch them play, or I'll get the parent sometimes. Actually, I'll get the parent to sometimes go on the floor, but I'm jumping ahead of myself because I do have a slide on parenting and working with kids. Okay, anything else?
Potentially you'll talk about this a little later, but about copyrights on symptom tracking measures.
Yeah. I have a slide for that.
Perfect.
Okay. All right. So here I just got a little slide on actually I kind of went through this on the last slide when we were talking about clients not liking it. So with online therapy, because it's so new with people, but actually you should be doing this in face-to-face sessions, because often face-to-face is new for people. You want to address concerns early, help them problem solve, make sure that they're feeling comfortable, that it's working for them. And we can't do this right now, but this is sort of a general, if you're offering an online therapy service, if you can say, if you want to switch back to face-to-face, you can. So don't ever let the client feel like they're forced into online therapy when we're past this COVID-19 thing. Now my college says, public health says we're supposed to offer telehealth right now, unless it's an emergency. So you want to confidently explain the research and the experience of online therapy, that people do find it works well, and that they enjoy it, that there's high satisfaction, but you have to give it a try, it's new. You want to be realistic about online therapy, just as you would face-to-face therapy. We're not supposed to sell it as a miracle cure. So if you know the stats about treatment, or if you happen to be treating a particular condition where you can't find research on it, which I think it would be hard to do, but maybe, then you would want the caveat to, that we know this works face-to-face, but this is fairly new to do it via video. So just so that you know that. And you need to really help onboard your clients, explaining how you will meet, when you will meet. I explain the waiting room to my clients. A bunch of you showed up here yesterday because I saw you in my waiting room when it was turned on. And so I got to meet a few of you before the meeting to let you know, no, it's the wrong day. And so what to expect in between sessions, that I'm not available 24/7, and just setting good boundaries. And so I put that into my informed consent. And then update your consent form to cover all of this. So I do cover the consent form in the YouTube videos. Okay. Any questions there?
Someone's wondering about phone versus video.
Yeah.
Noting that most of our patients have opted for phone, but that, what would be better to use?
I like both, actually. I'm equally comfortable with phone versus video. In some ways, phone, you have to be a little bit less on camera. So I can focus on doing my notes. And so that's one of the advantages of being on phone. I can pull up exercises that I want them to do. I often have them, whether it's phone or video, have a pen and paper handy. So I'll explain, even though I can't hand them a worksheet, I'll explain it. But when I'm on phone, sometimes it's a little bit easier for me to kind of rustle around my desk and not worry about maintaining eye contact. So it's one less channel to focus on. So I kind of like phone, actually. I like it when I have a mix of phone versus video throughout the day. And I'd say, I always offer phone or video. And I think for me last week, it was almost 50-50 phone or video, by choice. And then a few times phone because too many people were on Zoom at once. We couldn't get it working. And video was slow, so.
And this is regarding informed consent. And so wondering whether asking for verbal consent rather than having a signed consent form. Apparently, this person says it's common practice in Quebec. Do you have any thoughts?
Yeah, you can ask for verbal consent and document it in your chart. I use an electronic health record. Everyone wonders which one I'm using. I'm using Jane now. I've used a lot of other good ones though, but I like, it's the latest one that I'm using. And you can send an electronic consent form to them that they sign, and then it gets automatically put into the chart. So that's what I've been doing through my electronic health record. That's probably the easiest way. If you're not using an electronic health record, then there are some encrypted email services like Hushmail that lets you do forms where you can have them, check and kind of initial the form. So you could just set up an encrypted email. You want that to be private, so don't use your Gmail. Make sure it's an encrypted service that you can get the secure information back and forth. Someone told me they use something called DocuSign, and I've used DocuSign to sign other agreements, but I don't know how private it is. So I haven't looked into the privacy of that one. So there's different ones, but you know, check with your regulatory body if you can do verbal consent and document it. You know, I think it's always nice to have the actual written consent. And I like, because the consent is part of the onboarding process for me, because I have them initial or check all these boxes saying they agree to individual components. It's like, it's not just one signature at the end. I kind of force them kind of to read that, you know, it explains, here's how we meet, here's my personal meeting ID, please have secure Wi-Fi. I go through this in the other video, but there's quite a lot in my consent. So it would be a lot to do verbally.
Thank you.
Okay. All right, so assessment. So here we go with assessment. So this is a harder part of online therapy in terms of trying to assess somebody remotely. It absolutely is more challenging. Typically, what you can use are questionnaires. That there's a number of both open source as well as, you know, copyrighted questionnaires that you can use. I use a number of different ways to assess people. What the research is showing with most questionnaires, and you can search for any particular questionnaire that you want to do, is that the reliability of questionnaires is often maintained. So you get similar psychometric properties, you can use the same scales, it's obviously easier to score. In a lot of cases, there's some systems that let you track progress as well. But check for the particular questionnaire that you want to use to see whether or not the reliability is maintained through online administration. And the majority of cases it is. So that's good news. So you can, you know, do pre-post measures. I really like regularly measuring symptoms to see that treatment is working, and also to help me target the symptoms that I want to address in treatment. So I'm often sending questionnaires to people, and I do that a number of different ways. There's a few secure platforms that you can use for questionnaires. There's a Canadian company called GreenSpace. I've signed up for their free version and played with it a little bit, but I ended up just like creating questionnaires in using open source questionnaires in my Jane app, and then I can send it to people, and I kind of like that. I have to score it by hand though, so that's the trade-off. So GreenSpace scores and tracks, and you see nice graphs of patient progress, but the Jane app, it's integrated into my health record. And then I have to set it up. I have to build the form myself, but then I just press a button and it gets sent to the client, or I can have the client fill it out in the room with me if it's a face-to-face session. So that's sometimes handy if they didn't have a chance to do it by email before. Hushmail is an encrypted email service that has forms. So they have a number of questionnaires that you can, templates already up. They're sourcing different open source questionnaires that you can use, and you can send those. And I believe they score them for you too. And then some of you might be familiar with PAR iConnect. And then there's other ones too. I use the PAI a lot for adolescents and adults, and sometimes a few career measures. So I use PAR iConnect quite a bit. And that's kind of nice to be able to do. Usually when I do the PAI, I like to be there to answer questions and make sure that they're the ones doing the assessment. So what I do, but you can send it remotely to people. So you can send them an email and do it. But I tend to do it while I'm on the phone with them, so they can ask me questions, and or on video, and I have some assurance that they're the one filling out the questionnaire. So if I can't be with them in person, I'm there with them virtually while they fill out the questionnaire. What some of the research on assessment shows is that you do need to supplement any questionnaires with phone or video, that you shouldn't be making a diagnosis on the basis of screeners. No surprise there. But that when you add phone or video, you can do a fairly good job supplementing that. Oh, and I mentioned like use of video to supervise completion of questionnaires if you're concerned about who's filling it out and when. One of the other ways that you can use video with assessment is you don't have to do a home visit to assess the home environment. So this is particularly useful in some cases of OCD and certainly hoarding or even depression to see, you know, how they're doing, how they're functioning at home, you know, how are their ADLs? And so having them give you a tour of where things are at, I wouldn't necessarily do that in the first session, but as I build some rapport, that gives me a better idea of how things are improving. And then there's this I think is an open source article, the Luxton, Pruitt, and Ossenbach. They talk about some of the pros and cons. So if you want to go into a little bit more detail about that, you can Google that review, which is not too bad. You can look and see if there's something a little bit more updated, but that can be a good one. What I've read too about cognitive assessments online, you need to use some caution. Like there are some assessments that you could do like fluency, you know, or you're doing different memory kinds of tests. It's not the same as being in the room with the person and getting their attention in the same way, especially if there's some cognitive impairment, or they're kind of flustered, you know, before setting up their computers to get started. So, you know, you can maybe do it to test, you know, test the basement to see, you know, like if they do well online with fluency, then, you know, like they're no worse then. So, but I don't know that you can use it as a standardized assessment at this point anyway. I don't know that I'm not aware of anybody who's standardized any online cognitive tests. There's some online, I don't do a lot of this stuff, so this is where I'm struggling. I think there are some online tests as well. I don't know how well validated they are, that online tests that test cognition. So I'd have to poke a little bit more around. I don't know if PAR or any of the other big test authors have done very much in this area yet. Okay, any questions here?
Yeah, so we have someone wondering how much we need to worry about test security with online administrations when it's hard to monitor while someone's completing the survey.
Yeah, well, you know, it's just if you send tests, like if you were to send a paper and pencil battery home with people, you don't know who's filling it out. So I always prefer to have people do that in my office. You know, you have to sort of judge by the patient. If you're really concerned about it, I would say jump on a video call with them and then send them the link and watch them fill it out. And then you see that you get it in your inbox. So, you know, you can supervise remotely would be the one way to do that if you're worried about that. Okay. Making sure it's the right person filling it out. Also, if there's any concern about, like, depending on what you're doing, you might want them to even show you ID, like hold their driver's license up to the screen so that you can verify their identification, and then you know that's that person doing the test, like if it's a new to you client.
Okay, and we have another question that might be more relevant a little later, but there's someone wondering about adapting group CBT to a video platform.
Yeah, that's later.
Recommendations, perfect.
Yeah, we'll talk about that. Okay. But yeah, there's a lot of great free tests. Actually, GreenSpace, I think, usually uses mostly open source questionnaires. And a lot of the online therapy research out there uses copyright-free tests as well. So there's quite a lot out there that you can use. So if you search for online therapy and for a particular concern that you treat, there's a good chance that'll help you find some of the questionnaires that you might want to use in your practice as well. Okay, next. Okay, so now we're moving into treatment and how I use CBT. So I was chatting with Heather Hadjistavropoulos on the weekend and chatting about what I was going to talk here, and she's like, make it more practical. So I'm gonna treat this a little bit more like I would with a supervision session with a grad student maybe, and talk about more like, how do you do this, and how do you actually go about doing it. And I had to, I've been doing this for so long, I had to kind of think about like, what are some of the things that I do? Because it just seems so normal to me now that it doesn't feel like that big of a deal. So I think I caught a few little stories in different ways that I use it that maybe other people don't. But if anybody else has, you know, some experience, or I'd love to hear any tips that you have, and if you've been doing this as well for a while. So I mentioned a little bit earlier, you know, it's a nice alternative to home visits. I don't do a lot of home visits. I do even fewer now, but there'd be a few times, like especially for people, I treat a lot of OCD, where I would do home visits, helping them do certain tasks in the home. Like if I can't find any way to do exposure in my office, then, you know, I'll sometimes arrange this with people. So some of the things I've done live, but now do via a video, or things like putting groceries away without wiping them down. That is very hard now. A lot of people are recommending you wipe down your groceries, or I'm hearing a lot of that here out in BC with COVID-19, but, or coaching during hand washing. My office isn't really great to do hand washing with people because we have a men's and a women's bathroom. So if it's a man, then I'm not going to go in there with him. And even if we're two women, then it's not private either. Like it's a shared bathroom on a floor. So I can coach them during their hand washing, trying to get them to shorten it, for example, via video link, where they set it up, where they usually wash their hands, or they usually perform the ritual. Some other things that I've done is working people who are afraid of, say, touching bleach or other chemicals, like they're afraid to go under their kitchen sink. So I can be there with them while they do that. And then I can help them make little messes and resist the urge to cleaning up. So basically it's like I can be there. I found it's worked quite well. Usually the client has to have some sort of stand for their phone, or so they don't have to hold it, that they can focus on what they're doing, or use a laptop or some device that they can move around. So that's more and more people are able to use their phones now, which makes it really easy for me. This was harder to do 10 years ago when I would do this with people. You know, for people who do a lot of work with hoarding, you can potentially be there. You could do a session where you help them with their sorting and discarding, and coaching them through that. I've done mostly telephone for agoraphobia. So like being on the phone with them while they leave the house, and helping them pace where they go and what they do, and slowing down their breathing. And then it was just really nice too, to catch the thoughts that they have while they are doing the exposure live on their own. So it's one thing I actually really like it, because so often, you know, if you are recommending a certain kind of exposure in between sessions, then you have to wait the next week before you get to hear how it went. So sometimes if people are having trouble for too many weeks, I'll recommend that we do a phone session where they're out in the environment where they need to do the exposure if they're not nervous around my office. And then I can be on the phone with them talking. The one thing I don't do though is phone therapy with driving, because I think that's a bit of a distraction. So usually for that, I recommend if people are very nervous driving and we get them to a certain point where they're ready to try, I actually tell them to use young drivers or driving instruction service, like to book an hour with an instructor and have their driving assessed, because a lot of anxious people, I think, aren't that safe because they're too cautious. So I like for them to have a professional driver, and then I don't want to distract them, even with a hands-free set on the phone. So I think that works better when you have a professional in the car with them who knows how to teach drivers how to drive safely. I've had a lot of good experience with that. So that's the only one where I don't insert myself. But definitely for people leaving the house, or if they're a passenger in the car, or walking outside of the house, they have me in their pocket as sort of like a first step. Eventually I want them to do it on their own. I don't want to be their safety person. But it's been really, really helpful. And I've learned a lot of things that I wouldn't have if they just came back and reported to me in the session. So I really like catching those thoughts live as they're happening. So I really enjoy having those options for exposure therapy, and for me to be there to talk people through and to help push them to do a little bit more. Because really for anxiety, you need to help people gently push, encourage them that they're okay and that they can keep going. In light of COVID-19, I have a lot of people who are hand washers right now and afraid of germs. And so this is throwing them off. So the focus has really been how to stick to guidelines. A lot of the clients I'm working with right now are washing their hands way more than any surgeon is. And so helping them, coaching them through when they should stop, or sometimes even, having them stick to sort of guidelines. There's lots of video tutorials online. And so, I can pop one of those up. I can share my screen and pop on a YouTube video of how you should be washing your hands, and have the person mirror that. Try and stick to what the recommendations are, but not to overdo it. So those are some of the things that I've been using for exposure therapy for quite some time, that are really nice. And I think it's changed my practice quite a bit, in that I get a lot more information about exactly what's going on, rather than just relying on client report when they come back to the session. Any questions there?
No, none currently.
Okay. Does anybody else have experience doing this? Have people done this in the past? I'm pretty sure I'm not the only one.
Someone noted that it can be especially helpful when you're coaching on checking or counting with OCD as well.
Oh, yeah. So basically anything. I guess I thought more about the people with germs this week, but absolutely, being able to leave the house without checking the lock again, and coaching them through that. I've done that in the past too. Yeah, there's any infinite numbers of ways that, ways that you can be in your client's pocket while they do some of these challenging things, and help scaffold them, encourage them to do it. And then you're there for the win too. That's the other really nice thing. When they you actually don't just get the report the week after, you can help them celebrate what they were able to do. I think is really nice for people.
Yeah,
Okay.
someone is wondering if you could add the link to the hand washing YouTube video.
Oh, yeah, I'll put it up. I found one where it was a doctor showing how to wash your hands on YouTube. It's not me that did it, but yeah, I just Googled or searched on YouTube and found a doctor who showed how to do it and how long to do it. So I'll find it again. They're pretty easy to find. There's more than one now too these days.
Thank you.
Okay. All right. And here's where I really, 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 really love having a video link, is for behavioral activation. So when you're working with someone who's depressed, we know one of the most effective ways to help them improve their mood is to increase their activity levels. And there's a number of ways that I do that. So, achievement, often if the person's very depressed and they're not cleaning their house, for achievement activities, I often suggest housework. So I can be there with them and help them break the task into smaller chunks. So I can also see how they're functioning at home, what the situation is at home. And also they can be surprised at how much they can do in 15 minutes once they get started, so I'll say, I know you don't feel like doing this, but let's do the 15-minute rule. And if after 15 minutes you want to stop, you can stop. And many people are really surprised at how much they can actually do in that 15 minutes, how many dishes they can load in the dishwasher, or clothes they can put in the hamper, or at least have their bed made, and pick one small thing that they can do. And then the other thing I'll get them to do is, while they're cleaning, to sort of talk about what they're thinking or feeling about the task or doing it. And, you know, even if it's like how much they hate it, or they're tired, or it's not going to make that much of a difference, and or, you know, that it's going faster than they thought it would be. You know, sometimes, you know, embarrassment to share that with me, and you know, I'll say, well, you know, depression does this. It's okay. This is why we're here working together, and reassure them, you know, that no judgment happening. And so coaching through housework has been really, I find it kind of a fun way to have a video session with some people. And it's nice because you see right away how the impact of achieving that little task has been for them. They realize they did have the energy to do that, that they weren't too wiped out after. I'll get them to note, you know, how do you feel looking at your made bed, and does that change anything for you? And we'll look at the impact of the made bed on their depression, which might be slight, but you know, there might be a little bit of pride. So, you know, it's a number of things that you wouldn't normally get to do if you say, okay, this week, you know, I want you to make your bed every morning. It's not the same as sharing the experience with them and helping them to accomplish that together, you know, to show them that they can really do it. And then a lot of people, you know, aren't as comfortable. They feel very overwhelmed, you know, if the house has gotten away from them, and they haven't had somebody coach them into breaking things into smaller chunks. So, you know, what might seem obvious to us might not seem obvious to someone else, or, you know, maybe they've forgotten it because of the depression. So helping people that way is really, I found powerful. Those are some of my favorite sessions, actually, when you get, you know, control of a little corner of your room. So it'll be interesting to see, you know, how this goes. If it looks like we're going to be doing the physical distancing for quite some time, you know, if this is going to be more and more of an issue as people are working from home and needing to keep their environments tidy, to keep their moods up. Enjoyment activities, you know, sometimes, you know, I was thinking about things just even in quarantine, or when I'm doing a session with somebody at home. One of the things that I'll do, I was working once with a client who really liked fashion, but her depression kind of got in the way of wanting to get dressed up. So we were doing a video session, and I asked her, well, you know, go to your closet and show me a favorite outfit. And she pulled it out, and I asked her to tell me about it and where she got it and what she liked about it, and how, and so we just had and I like clothes too, so I can talk about that forever. And it was super cute. And so we just talked about this piece of clothing that she brought out, this outfit, and her whole demeanor changed. She, you know, had a little smile, and you know, was quite proud of how she found it and some of the modifications she made to it. And so I would remark on that, like how just that little bit of pleasure made her feel a little bit lighter. And then I had her rate her mood looking at the outfit, and it had improved a little bit. So, you know, looking for those little things, you know, sometimes enjoyment activities, especially in quarantine, are just going to be what gives you a bit of pleasure. What are some things that maybe just take the edge off of this? So other things I've had clients do is play their favorite music, or even show me their favorite color, you know, or if they have an interesting paint color, you know, I'll comment on that, and they'll go, oh, I love this color. And so we'll talk just about how much pleasure color can give you, how important that is. As an aside, I hear that paint stores are really selling out of paint right now. A lot of people are painting at home while they have this time off. So I guess they're getting it delivered. But and then, you know, but they have, when they're at home, they have a lot of their favorite things at home. And so, you know, it might be harder for you to get them to think of their favorite things when they're in your office. But when they're at home, they can look around the room and look on their bookshelves, and, you know, you can have them, you know, pull off their favorite book, or pull out, you know, a lot of people still have vinyl, they'll have records. Show me your favorite record. my teenager got a record player. I don't know. There's a resurgence of vinyl. So people who are into records really get excited talking about them. That's all there for them. And so when we're talking about enjoyment activities, you don't just have to make a list. You can do it right there in the session with them, have them pull out their favorite things, and then note the impact of that on their mood. And, you know, for behavioral activation, I like to say, you know, like often we get better from depression, you know, just sort of 1% at a time, little by little. So if we can add all these little things into our life and make sure that, you know, we do things that kind of nourish our soul, you know, little by little, it helps a little bit, or at least, you know, keeps the day from getting worse than it could be. So you actually get to see that in action when they're at home, and they can pull those things out for you. For closeness activities or increasing social connections, I'll get them to pull out a favorite picture that they might have at home in a frame. I've been meeting everybody's pets lately because the dogs and cats inevitably make an appearance, but sometimes a lot of people just want to show me their pets. So actually I really like animals, so that's a big plus for me in doing online therapy. But then I'll remark on people's smiles or how they relax, how everything kind of changes when they're around their pet, and the impact of their pet on their mood. And so that can be quite nice too. So video therapy just doesn't have to be sitting in front and doing talk therapy constantly. Like the clients have the freedom to, if they have a device that's a bit more mobile, and if you want to plan one of these sessions one time, you know, ask them, you know, if you could maybe do your phone this time so we can go work in the kitchen on your hand washing or whatever it is that you have planned. You can plan ahead for that, so that, you know, you treat it more like a home visit rather than just a face-to-face therapy session. And there's a lot of really cool things that you can do. There's a lot of opportunities to help in ways that, you know, aren't available to you in office. Okay, are there any questions there? Oh, is Leanne still there?
I don't know where Leanne went, but
okay.
I don't see questions. Oh, wait. How do you deal with family members being at home is the question that just popped up.
Yeah. So usually what I do is for most individual sessions, I'll ask that people are in a private room when we do this. And then, you know, if it's going to be an activity like this, a private room where they can do this particular activity, like they get the bathroom to wash their hands, for example. But sometimes I do involve family, you know, like especially for OCD, that can be helpful because then the partner can help coach, or with kids too. When I'm not there, the partner sees how I coach them and encourage them. Because sometimes, you know, in couples, they're like, well, just stop washing your hands, or they get frustrated, or why don't you do what Dr. Korol said? And you know, but when they see how encouraging but gentle that I am, then I'm modeling for the family member. But what I do tell people is I want to know who everybody is in the room. Like, you know, is there anybody off frame? Is there anybody listening in that I'm not aware of if it's a telephone session? So I have everybody identify themselves. And so sometimes I'll do like a family meeting if it's appropriate. But if I want it to be an individual meeting, then I outline those guidelines with people.
We had one other question, which was to request to speak more about child therapy online.
I think, where is that? There's a slide coming up for that. So I'll get to it.
Well, and Leanne has lost her co-host status because she lost her internet connection. So
oh no, okay.
For a second and reestablish that.
Okay.
I'm back.
I don't know if you. Oh, you got audio? I don't know if, Andrea, if you are able to do that for her. I think as co-host, you can reestablish her as co-host. If not, let me know.
If not, I can still unmute myself and see everyone's comments. So
oh, okay, super. Okay. All right, I'm gonna go to the next slide here. thought records and worksheets. So here I use a lot of screen sharing with people, and I'll just actually usually have Word open. Just make sure you don't have anything else on screen that you don't want a client to see. The way and different video clients, video links let you do this different ways. In Zoom, you can also just select the program that you want to share. You don't have to share your whole screen. So like for this talk, I'm just sharing PowerPoint with you, but you don't see the background on my desktop. But you can upload, if you have a fillable PDF or just, you know, a template, a Word template that you can use, you can take that and then put it into your clinical record. If you're sharing it on your screen, often clients want a copy of that. So what I'll do is we're both working on the screen, and I'll be typing in and filling in the thought record or a collaborative case consent, whatever worksheet I'm working on. I'll be typing and filling it in as we work together, and then we're both looking at the screen at the same time. If the client wants a copy of that, then there's a couple of different ways I can share it with them. I can send them an encrypted email that's password protected, and then they can get it safely. I can also upload it to Jane in my case, and there's a way that I can share, but then they have to log into Jane, and then they get to see the documents that I've shared with them in Jane. So I've got two different safe ways to share that with them. And I find it works quite well. Those are kind of enjoyable sessions. I've had whole sessions where we've like just worked together mapping out a particular worksheet, and I find it's pretty engaging for the client too. And then sometimes I have them, there's sometimes, like especially for trauma, like if I'm doing a bit of cognitive processing therapy with somebody online, I'll sometimes get them to share their screen and do the writing themselves. Like there's just a few things that I do with people where I want them to do the writing rather than me take dictation for them. And in that case, obviously you don't have to send them a copy. Rather than have them send me a copy though, because I don't always trust clients to send it to me securely. I don't like receiving emails from clients other than like appointment changes. In that case, I just take good session notes, and I don't worry about having the actual copy that they wrote in that case. I suppose depending on the device that I'm on, I could take a screenshot as well and upload that to my clinical file, but I've been just taking really good notes in that case. Then, yeah, it works well for, the main ones I use it for are thought records, collaborative case conceptualization. Oh, I do a lot of CBT for nightmares. Does anybody else do that? You raise your hands. I'm the only one. So you get people to write out their nightmare that they have, if they have a recurrent nightmare, and then you rewrite it so that it has a more positive outcome. You can even get quite silly with it because it's a dream, and then you have them practice the visualization. So in that case, often I get them to do the writing. You know, so it works well for most simple worksheets. Or, you know, some people I know say they've emailed them. I haven't done this, but you could email the client a fillable PDF ahead of time. And then they can, securely of course, and then they can fill it out while they share their screen with you online. So there's a lot of people that are really comfortable doing this. Most people, especially now, I'm finding are using Zoom a lot for work and getting more comfortable doing this sort of thing on Zoom, or if you're using the healthcare version of Microsoft Teams, should do that fairly easily. I don't know about Jane with their new online one, but this is where you can talk to your colleagues and see, you know, check out different platforms, what their capabilities are. And they're also, it brings up like another thing, like those are the sorts of things that you want to look for in a platform. Like, how is the sharing, how safe is it to send things back and forth on this? I was reading and preparing for this talk. Zoom does something that I didn't realize, that you can actually share documents in the comment sections with each other. So I'm going to do a little bit more digging to see how secure that is. I'm assuming because I have the healthcare version, it's pretty secure. But but I'll take another look on that. I just also need to see where the data, how it gets sent through. So I want to double check on that, but there's secure ways to share that with people. I like clients filling out their worksheets though whenever possible, like whether it's a thought record or like a more of an imagery script like CBT for Nightmares is, because they get more practice doing it on their own. I might do the first one or two myself, but pretty quickly I'll move to getting them to do it themselves. And I think even though like I'm coaching them through it, there's more of that, I don't know, muscle memory and being able to do it on your own. Another option though that I've done is good old-fashioned paper. And there's a lot of worksheets online that sometimes I'll get people to download. I really like the Center for Clinical Interventions. Does everybody know them? Yeah, they're great. So I've had people print off even like whole workbooks from Center for Clinical Interventions. And, you know, if they need a little bit more structure and scaffolding, sometimes we'll work through the workbook together, you know, especially people who are depressed. We'll read it together, I'll answer their questions, and then I'll help them fill it out as they go. So I'm reading my copy while they're working on their paper copy that they printed off at home. That actually works really well for a lot of people too. And I think it just gives them, you know, a little bit more focus in sessions. And then I think builds their confidence that they can do some of those worksheets. If people have a copy of, I get people to do a lot of mind over mood work too. I really like that workbook. So I have my copy, they have their copy, and we work through it together, and I get them to read me their answers. And, you know, if they're stuck, then I'll help them with a particular part of it as well. So it's almost like I'm a tutor in a lot of ways, working through the home study materials as well. So it doesn't all have to be on screen, although there are some things I like about screen. Good old-fashioned paper while you're talking to each other can work really well, can work really nicely. So those are some of the tips for thought records. Any questions there?
Yeah, are you aware of any secure platforms to work on kind of a Word document simultaneously?
Well, I've been using Zoom, but like document sharing, you know, kind of like you can in Google Drive, that sort of thing, where you're both
not working simultaneously, I imagine.
Yeah, I would think Microsoft Teams actually, because you can do a HIPAA compliant version of Microsoft Office. And I haven't done this. Actually, like I should talk, like if you listen to the tech talk I have on YouTube, I do it with my husband, and he's like a Microsoft reseller, and all I know is Mac. I don't use it very often. So he sets up all these things for me, and I'm just like, oh, I gotta learn how to use Office. There's a lot going on in Office 365, and you can get a healthcare compliant version. I just haven't done a lot of that, but I imagine you could like share a Word document and work together on that. That's one thing I haven't done, but actually now I kind of want to do that. That question's brought up. So maybe I'll do a video later. I'll get Doug to show me how to do it. We'll do a screencast of how you might do that, or some options. That's a good video.
And there's a couple of questions from the period of time where my internet was down. So they refer to the previous slide.
Oh, okay.
So someone was wondering, it's more about kind of safety and privacy. So the first question is about, do you have any recommendations on how to handle client rigidity when it comes to not wanting to do teletherapy when their children are at home?
Sorry, say that, you kind of cut out on me there.
Oh, sorry. How to handle when clients are rigid, not wanting to do teletherapy when their children are at home?
So that's a tough one. You probably, usually I'll get a little bit more flexible in terms of timing. Like, you know, if someone else could look after the kids while they're in the room, but if they're really rigid, there's not much that you can do.
Mm-hmm.
Yeah, I think if they're uncomfortable, they're uncomfortable. You could, you know, maybe suggest the 15-minute session or shorter session. might be more acceptable, like being away from the kids. Like if mom can watch the kids while dad's in the other room for 15 minutes or vice versa. You know, that, you know, it might be more doable in a shorter session, and you can still do quite a lot of good in a 15-minute session, or offer a test session to see how it would go.
And the last question is about how to ensure safety when working with a client that's in an abusive relationship or family.
Yeah, that's also difficult because it's going to be hard to have the session safely. Sometimes you might want to suggest that they have an email that the other person doesn't know about, but they'll have to be careful. I would be careful, sort of cautioning that, like they might want to talk with almost like an internet privacy expert about sort of best recommendations on how to set up accounts so that somebody else wouldn't find them. But it's not an area of expertise for me on how you would do that safely. So you just want to exercise some caution, you know, or if they're able to do it, you know, while they know the person won't be listening or around the house, and to set up your phone or system so there's no trace for them to find. I think that will almost require a consultation with an internet privacy expert about best practice in that area.
Okay, thank you.
Oh, the other thing I will say, actually with kids, I've done text therapy with people who don't want to do therapy with the kids around, like they don't want to talk about the kids within earshot. So I have done that. I'm looking for a new platform to do that again. I had one platform that was great for that, but terrible for video. So I'm not using it anymore. But the text function worked really well for texting back and forth. So, you know, if they're concerned about people listening in, but they're okay typing, then that can be an option.
All right.
And also text therapy works really well when you have laryngitis. That happened to me last year. I really lost my voice and I had a few people who are like, can we do something? Can we at least text? So I'm like, okay, if you're good with that. And then one session that we jumped on the phone and the person would talk and I would text back. So we did that through my system. So where there's a will, there's a way. Okay, so let me go here. So parenting, here we are with the parenting question. So there's a lot of advantages too for parenting because it's, again, like it's similar to home visits. It gives you a window into the home environment and what might be happening. I think I mentioned, you know, for younger kids, I mostly do parenting. I'm not doing a lot of play therapy online. I'm sure there are people who do that. I just don't, so I can't speak as much to that. But sometimes I'll watch the parent play with the child, and I'm looking for more things like attunement and how the parent's responding. And sometimes, you know, if they can have like a Bluetooth headset in their ear while they're doing that, I can kind of coach them, you know, with different suggestions for what they might do, you know, especially for sort of like playing but not teaching, and just doing like sort of undivided attention, mindful attention on your child, and looking at how that changes behavior. It's really fun when the child has a tantrum. You know, if you get lucky and it's a little one, you can coach them through, you know, how to handle the tantrum and what to do. And then it's also, I think, nice to, you know, get a tour of the child's bedroom and the toy room. Often kids have way too many toys and it's a very overstimulating environment. So I'll give tips about, you know, bedroom setup and, you know, how many toys kids reasonably play with at any given time. So that's something that I don't get to do when I'm just consulting in the office. You know, I do get a view of what's happening in the room. The other thing too, I like to look at, because I'll often, you know, use behavioral charts and rewards with parents, is looking at what their setup at home is. You know, and if they, you know, they might have a setup that's not really good for a preschooler, you know, that would work better for an older child. Or, you know, kids are getting too many treats and there's too many fun things around, so they're not really motivated anyway. So, you know, from a, you know, behavioral parenting standpoint, you can see a lot about the home environment and how parents are setting things up. The other thing I like to look for too, if the parent's struggling with depression or stress, you can check the state of the home, you know, see how well they're functioning and managing at home, or maybe where they need some help and support. I also find I get a lot fewer cancellations when it's around parenting because they don't need a babysitter. And I love it for sleep training when you're working with parents who are trying to get their kids to, whether it's a baby or an older child, you know, if you can time the appointment for nap time, or get the parent to kind of time the appointment for nap time, and we can look at the process of how they put the baby to bed, and also what their thoughts and feelings are while they're going through that. So I do tend to stick to parenting when I'm doing online therapy, but, you know, do treat it like a little bit more of a home visit. And sometimes I'm just in their ear coaching them through. So they have the camera set up and I can watch them interact with the child. And then I'm through the Bluetooth headset, the bug in the ear while they're working with the child or disciplining the child, which can work quite well. That's not something that you get to do, you know, where the child's maybe a little less aware of you being in the room. But you get to be that remote coach. So it's kind of fun, actually. And the feedback I've had is that parents really like that. And, you know, I'm often able to reassure them that they're doing a good job, you know, that, you know, it's hard doing a lot of these behavioral interventions and it's a long game, you know, that, so when parents are practicing these strategies on their own at home, they often don't realize that they are doing a good job, that they're doing it right, because it's not magic. You don't just, you know, do the right thing and your child is perfect. But it's like knowing that, no, you just have to kind of weigh this out and, you know, not give the child what they want. Like if they wanted to run in the middle of the road, you wouldn't let them do that. And so you're just going to stand your ground here, but be nice and calm. And I can usually help them say things that help them stay calm and stay on course. So, and then the child's more comfortable because they're in their particular environment. I don't really get to see how they are in my office, if, you know, particularly if they're little, because it's a novel space. So any questions there?
Nope. Thank you.
All good? All right. Yeah, but, you know, I would, if you're doing play therapy with kids, I would check and see. I'm sure there are recommendations for that. There's probably things that you could have the parent have available for them to play at the other end. That would be my suggestion, but you'd have to do a little bit more reading. I tend to stick to parenting, so I think it's a little bit easier. Okay. And then webinars and group therapy. So there's actually quite, you know, growing body of research on this. There's a lot of promise that this could really increase access to empirically based treatments where we can help therapists scale that. You know, if you miss a group, you might be able to at least get the recording, depending on the kind of group, so that you could reduce dropouts. There's a few things to keep in mind, though, that you want to be mindful of privacy and people recording from home. So it should be built into your consent that if you're participating in this group, that you're not allowed to record from home. There is a way in Zoom to disable Zoom recordings, at least from their end, when you have the healthcare account. I think if you have regular accounts too, but you are able to disable other people recording. But they can always use another form of recording. Like they could even just have, you know, their phone kind of secretly recording the session, right? And off to the side and recording the screen. Or they could be using something like ScreenFlow, which is a program like that records video in the background. So there's always that risk. But the other thing is you have to remember is everybody now in real groups, oh, see, there's my virtual background. My phone disappears and then here it is. It's kind of funny on Zoom. So anybody can bring their phone into a session and record. And I've heard some of those recordings, something like, anyway, that's a long story, that patients have like brought in recordings from other therapists. And I had one who, when I was at BC Children's, wanted to record the WIPSI assessment I was going to do. And that was a whole thing. I had to tell them, no, you can't. And then like, it's so cute. And I'm like, yeah, but this is a protected test. You're not allowed to record the session for a number of reasons. And often hospitals have policies, but people are recording everything these days. So, you know, making your clients aware of that, letting them know that that's a risk, but having them respect privacy. One of the things that you can do on certain groups, though, depending on how you, if it's more psychoeducational in nature, you can, you know, tell people that, you know, they can maintain privacy by not changing their name, like letting them change the name on the screen, or not share their video. Can be an option too. So if you're doing more like a webinar series where you're teaching people and people are sitting in, and then they can ask questions in the chat, and there's a little bit more privacy. It's also really helpful in these sorts of things, especially if you're just learning how to do it. But I think always to have a good co-therapist or co-facilitator. There's a lot going on, and if you're doing most of the didactic teaching, it's nice to have someone help you with the questions or figure out a tech problem, or assist people who may be jumping in and out of the meeting, or now there's a problem with Zoom trolls now. So people will jump into Zoom meetings, random Zoom meetings, and, you know, put up pornography and different things that are you don't want to show to your group. And so you want to have a good control on that. So, you know, two heads are better than one, and set, like Zoom in particular has a lot of different settings. And so being able to set all that up is really helpful. And then the other thing to keep in mind, I think I mentioned this a little bit before, but it's worth saying here that most people, there's this well-known online disinhibition effect, where people feel much more comfortable sharing really personal material online that they may regret later. So it's important to educate people about that, and to, you know, if you're having a group where people are sharing and talking more, being quick to jump in and moderating a little bit, so that people don't overshare too quickly, too early in a particular group, because often people will surprise themselves with what they'll say online in a group when they're at home comfortable. And I mean, there's some advantages to online disinhibition. Oh, do you see a hand raised? Oh, I thought I saw a hand raised. Okay. And then the other important thing to remember with an online group is whether you want to keep it opened or closed. You know, closed groups, you might have more sharing, and open groups, people are hopping in and out, so people might be less open. But depending on the nature of the material, and you know, if it's more psychoeducational in nature, open groups where you let new clients join each week might work quite well. For other groups where you want more sharing and you want to increase comfort and trust, then closed groups might work better. There's a lot of research on telehealth in groups, especially in cancer research. I'm more familiar with providing remote groups for cancer patients. And part of that is, you know, just having the ability to even come in when you're immunocompromised. Group therapy is tough for some cancer patients, depending on their chemo regimens, and or for rare cancers, where, you know, you might have to pull from people across different jurisdictions even to get enough to do a group. And so there's some cancer agencies that have done that. So there's some good research there on how to run groups in the cancer literature. So maybe I'll dig a few of those up too and put them up. So I can see the list of articles that I'm going to put together on the Therapy Think Tank website growing. But it's nice to keep on top of this sort of literature. And then if you can find other people or even other supervisors, I'm going to talk about finding supervisors in the next slide or two, who are doing this kind of work. It can be really helpful because it is a different way of working, and there's a learning curve. One thing that I think is important for therapists, though, is practicing this with colleagues. You know, so pretending, like, run a role play group, and before you try it live with clients, and see how just getting comfortable with the technology and going from person to person and finding, you know, there's a different workflow with it, that we have a lot of transferable skills, but it's the technical skills that are really important when we're running a group, because there's a lot of balls in the air. Probably about 10 years ago, I went to training at the BC Cancer Agency, and at the time, they're apparently not doing it now. They used to do chat therapy with these large groups. I don't know if anyone has heard of some of the cool work that they did there, but we all role played. I was working in Calgary at the time, and a group of us came out to see what they were doing at BC Cancer Agency, and we role played a therapy session via a chat group. And there was, you know, one therapist who had to keep track of everybody's typing simultaneously in the chat. And the therapist who was training us was quite good at sort of responding to everybody and reflecting and using different, but I just felt exhausted at the end of the day. And I said, oh my gosh, like that was just like fast and furious. Like, how do you do this? And she's like, you know, you actually get used to it. She goes, it's a bit of a learning curve. So it's good to have these practices doing therapy this way. And eventually, the more you practice, you get so comfortable with the technology, you don't think about it. And then you have more bandwidth to focus on your group. So that's the one thing I would add. When you are, it's one thing doing one-on-one, but you can feel a little bit more pressure to manage things when you're, you know, simultaneously presenting and running a larger group of people. It's good to practice, and it's good to have some help while you're on the call. And then it's also good to do a little bit of research about other groups that are out there, because there are more and more support groups. So teaching clients how to evaluate other potential groups that they might join is also very important, because there's a lot of groups that aren't that good, and they have questionable, like there might not be any moderator at all. A lot of these are also on Facebook now. Facebook's so easy to set up groups, and so many people are on there, and I belong to a bunch of different groups on Facebook as well. So, you know, all that information, letting your clients know, you know, it's a great way to connect, but Facebook's reading all of that. So there's really no privacy there. You know, if there's nobody moderating and making sure that nobody's putting hurtful comments on there, you know, so how porous is the group and how well protected is it? And then looking at the qualifications of the person who's handling the forum as well. So working with people so that they become good consumers of the various materials that are out there that they can use to connect with other people, because it can be really great to connect with people who are going through something similar with you. You know, especially if you have a rare condition or a rare situation, you know, it's nice to have other people that you can talk to, but how helpful these groups are really is quite variable, you know, so it's a bit buyer beware. So if you can be on top of it, you can talk to your clients about how to be safe. And then you also want to be, you know, bring this up with your clients as well, you know, and say, you know, I don't know if you've been thinking about joining a support group on this. And, you know, here's some things I tell people. I think they can be a great thing, so they're not embarrassed to tell you that they're doing this. No, but here are some things to think about, you know, and especially when I've worked with a lot of cancer or pain patients, I'll say, you know, keep in mind, like, everybody in these groups is struggling. Like, the people who are doing really well with their cancer treatment usually are living their lives, and they're not on these forums. So you're going to read a lot of people who are maybe even going through the worst case scenario, and they're not necessarily representative. So keep that in mind, you know, that you want to go to reliable sources, but also these forums are often full of people who haven't processed it. They're not in a good space. So don't think that's necessarily your future. And then they'll come back and say, oh, you know, that's actually true. So not only for your groups, even if you're not doing any groups at all, very important to be aware of what's out there, especially if you work with a particular patient population that they might all be accessing the same resource. you know, I don't think you shouldn't cyber stalk your patients or look at what they're doing, but you should certainly look at the main resources for a particular patient population and lurk a little bit just so you see how it works and what you've noted. And then I kind of lurk out. I'll just want enough information to see what the deal is with a particular platform so that I can caution people if there's a problem, or maybe even encourage them to use it if I think, you know, there might be some good things in there. But I usually do give that caveat that, you know, often online support groups, it's the people that are really not doing well and not necessarily representative that are on those groups. But they can, when they're great, they're great. So any questions there?
Yeah, so we have someone wondering if a client does record during group therapy, does that liability come back on the therapist if information gets out?
I think, yeah, oh, that's a good one. I don't know if they talked a little bit about that in the webinar that CPA did just last week with BMS, the insurance company. I think if you have an agreement, and you should talk to a lawyer too with this one, you know, if they're signing an agreement that they've agreed not to record, then you're doing the best that you can. So, but I would talk to my insurer, I would talk to a lawyer and have it set up so that all the other group members know that this is a risk, and double check, and then have the cybersecurity insurance too. But yeah, I'm not 100% sure. You have to check in your jurisdiction with your lawyer, with your insurance. And there's risks in everything. Like I say, like with a live group, people can be recording too. So it's not a risk that's only part of doing an online group.
Okay, and do you have any advice or some guidelines on managing suicidality when you have a client that's in a more remote community, especially?
Yeah. So when you're doing work with people in remote communities, you want to, if you agree to take them as a client, and I think I talk about this in my YouTube series, you want to make sure that you have a local contact. So usually I ask for an emergency contact, which might be like a family member or a friend, as well as a local, like usually a local physician, their GP. And some local contact that I can reach out to if I think that they're unsafe, and because I'm not in the community. So I need somebody that I can connect with. Whether or not you take, I mean, anyone in the course of therapy could become suicidal, so you can't screen everybody out. But if somebody, different therapists have different rules when they screen. So everybody asks me, is this person appropriate for online therapy? And it depends. It depends on your comfort level. It depends on your setup. You know, if you're seeing face-to-face patients, you're not available 24/7. So we usually tell our clients to go to the emergency room or call 911. That's no different for online therapy. You have to set that same boundary, and so that they know what to do in an emergency, that you've explained that to them. And you do your best. When I was working at the hospital in the outpatient psychiatry department, I have a lot more comfort because I knew people could come to the hospital 24/7. They wouldn't talk with me, but suicidality wouldn't be a reason to screen people out for that service. But for other services, it may well be. But at the very least, anybody can have a suicidal crisis. And so you want to have your contacts available so that you can do your best if you need to contact someone in their community. You need someone there that you can call on to do a safety check.
Thank you.
Okay. Anything else?
Do you have any recommendations, or would the same recommendations apply for sharing group psychoed content like PowerPoint presentations?
Yeah, can you say that again?
So sharing psychoed content with group members,
Yeah.
would use kind of the same thing as for individual clients?
So in terms of like just doing a PowerPoint presentation for individual versus group, or
how to share the documents?
Oh, to share the documents. I guess that depends on your comfort. You know, I think most of my stuff, I might give them a PDF of my slides if I were to do a group, and I wouldn't give them the PowerPoint itself that they could edit, but I might give them a PDF. I do have a bunch of, I'm going to talk a little bit about doing YouTube videos. And I have a few YouTube videos that I did several years ago. So we could talk a little bit about that there, maybe. I think I understand the question. Like, it's just about sharing materials with people who are in the group.
Yeah.
Yeah. Yeah, I'd be okay with it, but you know, that's up to you, how comfortable you feel sharing stuff.
Thanks.
Okay. All right. So I'm just going to talk about, since we're talking about online therapy, also to consider online supervision and consultation. I had at one point, God, how long ago was that? Probably about 10 or so years ago. I used to meet weekly with Christine Podesky on Skype, and we would, because I think that was one of the only things at the time when we started, maybe it was longer than 10 years ago. And she did consultation with me for several years. And actually, I wouldn't mind another session with her too, because she's awesome. But you can pick someone who's sort of like-minded to you. And, you know, if there's a skill that you want to learn, and, you know, chatting with different friends who are therapists over the years, you know, they'd say, oh, you know, I'd like to learn how to do this sort of therapy. You know, do you know anyone locally I could do some consultation with? And I'm like, well, who's your dream supervisor? Why don't you connect with them and see if they'll do consultation with you? Because you don't have to worry about jurisdictions then. And, you know, 9 times out of 10, when they contacted the original author of the book that they like, or researcher, they were able to set up the consultation service for themselves and get it straight from the horse's mouth. So that can be really a fun way to learn a new skill. Or if you want to offer that to other therapists as well, you get to share what you know with other therapists. I do some supervision of grad students at UBC, and I just love talking with students. I find it keeps me on my game. And I love watching them grow. And so, you know, there's a lot of us out there who love doing supervision and consultation. And so it's a really fun opportunity to work with somebody that you might not otherwise have had a chance to work with, to learn a particular skill that you're really aching to learn. You know, and if you're offering supervision, it can be an alternative stream of income too, another thing that you can add to your practice. That can be quite convenient, and then you're not limited to your jurisdiction as well. So you can help people. Usually, like when you're working with people, there's a difference between supervision and consultation. Like when I work with Christine Podesky, she was very clear it was consultation, that I wasn't using any patient names, that you know, wasn't supervision. She wasn't responsible for my cases. So she had a very clear outline of, and I'm sure that she had a lawyer draw up for her, spelling out what it was that we were doing. So, and then again, and check with your insurance as well. But yeah, it's kind of nice to have that variety and ability to talk with people. The other thing that I mentioned at the beginning is, you know, it's important to find a group of like-minded clinicians for peer consultation. So now we can't all get together in person, but we can certainly form groups with each other, you know, within and outside of our jurisdictions, where we do get to talk with people about not just online therapy, but any therapy that you might want to do, especially if you're learning it. And it can be really nice to talk about a tough case, or to have that group to call on. So I'm really hoping one thing that comes out of having to physically distance ourselves is that we get in the habit as therapists of doing these different groups, so that we stay connected to each other. Especially if you're practicing in private practice, it can be really isolating. It's really easy to not see another soul except your clients all day. So putting that time aside to talk about cases in smaller groups where you each get a turn to discuss. Here in BC, we're expected to do an hour of structured interactive activities at least 1 hour a month, a minimum of 12 hours a year, 12 hours a year of consulting with a colleague. But building this into your practice can be really nice, but especially since so many of us are on the steep learning curve of learning how to do online therapy, really important to make time for that and sort of learn together this new skill that we're putting in our toolkit. And then, I wish I'd put down where I found some of this. I think this last point on my slide came from Gerhard Anderson's book. I'm just looking, do I have it here? And show it to you. I think I left it in the other room. I actually have a bookshelf right here. It's not just the sky. It's The Internet and CBT by Gerhard Anderson. And I think it's that book where he talks about how, much like therapist-guided CBT, where patients do better, clients do better if they have a therapist coaching them to learn CBT rather than self-guided or self-help CBT. The research shows you learn more with supervision versus online continuing education alone. So, it's great that we have all these online CE credits available to us. It's a really convenient way. I noticed I got an email from my college last night saying that, we understand that conferences and things are canceled this year, but, here's what we'll accept for CE, and lots of online options. But when you look at the research, there's much greater skill development in therapists who supplement the online education with supervision when it comes to acquiring the skills. So one thing I hope happens a little bit more is that we get more of these CE presentations, but with follow-up, so that you can join a consultation group with the person who does the CE and then practice it online and really reinforce those skills. So any questions there?
Yeah, so we have a question regarding supervision proper. So where you would be sharing client information, would you recommend using the same types of platform as for online therapy?
Absolutely, yes. So if you are supervising a student or someone who's in the process of getting registered, you absolutely need to, whoever's typing, can you mute yourself?
I think Andrea took care of it. It's good.
Oh, okay, thanks. So whenever, you absolutely need the same secure channel that you would use for your online therapy service when it's actually supervision and you're going through case materials. Yeah, you treat it just like a therapy session.
Okay. And we have someone asking, what was the name of the source by G. Anderson?
Oh, Gerhard Anderson. He wrote a little book a few years ago. Gerhard Anderson has written most of the stuff on online CBT. He runs the Internet Psychiatry unit in Sweden. And so he wrote a book called The Internet and CBT.
All right, thank you.
It's a nice short little book. It's great. I was talking with Heather Hedges-Davropoulos. I was trying to find a reference where you could learn how to do more of the writing. And we were both kind of thinking, because we both, learned by doing and taking workshops from other people who were doing this. And, but he's got a little section in that book as well about the writing and a few little examples, but it'd be nice to have a bigger book on that. But that's a great little book. So Anderson's one of the big names in this area. So I'll put that up eventually. I gotta have a busy weekend building this website. So, oops, looks like I went backwards. All right, anything else?
No, that's good, thank you.
Okay. All right, and then we've got video psychoeducation. So this is something I started doing, I think my first videos I put online were like 2008. And mostly I did it because I got sick of hearing myself say the same thing over and over again in sessions. So, and I was working with Christine Podesky at the time, and I said, I'm just going to record my CBT for insomnia and some GAD stuff and put it on my website for my clients. And she goes, well, I know you're doing this to be less busy, but it's probably going to make you more busy. And she, of course, was right. And So, and then another friend of mine, she teaches therapists how to build their private practice, how to do private practice marketing. And she was telling me that typically people, potential clients will read and research self-help and different therapists for about 4 to 6 years before they actually decide to come to therapy. So they're actually thinking a lot about it before they pull the trigger. So when I was telling her I was going to do these videos, she said, no, it's actually a good thing, because a lot of people will make use of that before they're ready to come to therapy. So not a lot of research sort of beyond that, but the, videos do give your potential clients the opportunity to sort of get to know you. And what I found after I started posting these videos online is that they do tend to bring you clients who are a good match for your style and what you want to teach. So I did notice, a nice shift to people who are kind of ready to do CBT, and they wanted strategies and skills, and my voice didn't annoy them. And then I started to get people who were like smiling, like they knew me already. They were excited to meet me when they came in. So I talked to Dr. Podesky about that. Does that happen to you with Mind Over Mood? She goes, yes. And then eventually they get very comfortable knowing that I'm a regular human person. And so that doesn't last too long. And then I had one time where a client said, oh, I got the text reminder that I had an appointment with you. And I thought, well, that's weird. I just saw you. And then I realized I'd watched your video and it felt like I had a session already this week. So it's just a nice way to reinforce, or sometimes even if I say some of the same things in a session, I'll tell people not to worry about having to remember it. A lot of that information that we covered today is in the video so that they can go there. The one thing you do need to do is to stay on top. Like if you're going to put it up on YouTube, you need to moderate the comments or lock them down. So people can make comments. I do, usually answer some questions by telling them basically to go back to their doctor, that I don't give individual advice. But I get notifications whenever somebody makes a comment on my YouTube channel, and then I can delete it if it's inappropriate, which actually doesn't happen that much. I was surprised. And the main thing, like I have a CBT for insomnia video up. I get a lot of spam on there, people trying to sell different sleep remedies. So I'm always taking those down. But it's not too onerous, so it's been not bad to moderate that. And then I have those videos embedded on my website, so when potential clients come, they can see. One thing that can help is if you're going to start to do these videos, to have a little bit of media training. Most larger centers have publicists or people that can do media training with you. My media training with a publicist was very different than my media training at the hospital, because hospitals are very used to you only going on camera when something bad has happened. So like they grill me with all these tough questions, whereas the publicist is more like how you do your lighting, or how you wear your makeup, and how you use your hands in a video call. Also, making sure your camera's high enough, because if your camera's too low, you don't want the camera looking up your nose. So getting tips like that. So if you're going to do videos that you don't have to spend a lot of money to do a good looking video. iPhones now are amazing with the cameras that they have in them. So you can do something quite simple with just an iPhone. And you won't have to do a lot of editing, but they'll if you do some recordings and they can give you some feedback, then that can help too, because it can also be a bit of a marketing tool for your practice, although that's not initially what I had planned to do with the videos. It was just more, I had a really oversubscribed practice with a long wait list, and for some reason had a lot of insomnia patients coming to me all at once. And I got a little tired doing it over and over again. So then I could focus more on assigning that assigning the video to people, and following up on less teaching and more application their sleep data and problem solving with them and stuff like that. So any questions there?
Good at the moment.
Okay. All right. Now apps. So a lot of people ask me about, not only do people ask me about platforms that they can use for telehealth, but also what apps are safe to use. So just like evaluating any platform, there's a lot of great apps that help you track different behaviors, or people can use like a diary, or just even like a Fitbit or Apple Watch. You know, there's no apps that I use that I currently like share data with people. So like if people, because I do a lot of CBT for insomnia, I'll get people just to show me on their phone. So like I'll have them open up their sleep app. There's one I use called Auto Sleep that I like. And actually, like you can see, there, I got to keep my head in the frame here. There's my sleep data from last night. It only says I slept 5 hours, but that's because I forgot to put my watch on before I went to sleep. I actually crashed at about 9 o'clock. So you can add to, I slept about 7.5 hours last night. So pretty good sleep last night. Oh, and it says I woke up in the middle of the night. I don't remember waking up in the middle of the night. So anyway, I can fix that later. So, so instead of having people like send me electronically when I'm in the session, I just get them to show me. I get them to open up the app and I'll look, and then I'll look for their sleep efficiency score if they've got an app that does that, or if I have to calculate it myself by hand, then I'll do it. But I don't have them send me that data, because most of these apps, there's not a safe way to do that. And I don't like, even like Fitbit, you can add people and share, like, you know, like a fitness partner or a sleep partner. Don't do that with your clients. That's not secure. They're not sort of meant for use in a clinical setting in that way. So that's not something that I would do, but I tend to look at the app, but you know, they can hold the camera up to the screen, or they can read the data off to me. So it's handy for tracking and using. There's a couple of different organizations that can help you decide which apps are good and which apps aren't so good. Cyberguide.org. I'm blanking on the fellow who, oh gosh, what's his name? It's going to come to me later, but if you go to Cyberguide, you'll see who he is. He presented at ACBT a few years ago when I attended one of his talks, which was great. But you know, at that time, it was a few years ago, he was like, well, you know, usually if it's well designed and pretty, the information isn't great. And if the information is really good, then it's really not user friendly, because you know, the academics do good information, but they're not designers. And so now I think we're starting to see more and more of these apps be well designed, and they are really nicely put together, and a lot of good CBT apps. I think CBT, we want to collect so much data, and there's a lot that we can do with our phones now. So Cyberguide is really good, and all the apps that are reviewed are rated for their credibility, like is there good science behind this? And are they designed well? You know, so that's what they mean by user experience. Is it a good design? Is it a good user experience? Is it easy to use? And then there's their transparency in how the data is used and where the data goes. You know, and who's making money off of this? So like if it's a free app, like what data are they collecting? You know, just for one example. So that's a really great, actually user-friendly website put together by an academic who just really likes reviewing all of these apps for us, and a really great resource. So you can find some things to, you know, specific to a particular niche area that you might be working in that would be helpful. And then we have the Center for Technology and Behavioral Health. I find it's another group that I learned about when I went to that one CACBT workshop, and they I find most of the platforms and apps that they talk about there are related to addictions, but they have others as well. So you can look in there for, you know, especially if you're doing addictions research, they have a good list of things. It's put together by another academic, and if you're building an app or doing anything like that, you can also talk with them and get profiled on there as well. Then we have Beacon, and that evaluates health websites, not so much apps, but health websites. It's an Australian group. And then the Anxiety Disorders Association of America also reviews mental health apps as well. So that's a good website. But, you know, for any app that you're considering, you can also go to Google Scholar. If you don't have access to a university library, start researching some of the research that is put out by these organizations, and make sure that they there's some data to them. You know, often a lot of apps say they're effective and they're good and they're this and they're that, and when you look, it's the marketing people that have really kind of skewed the data. So you want to be cautious in terms of, like, if there's an app you think might be helpful, looking at the research. I went to one talk, and I wish I could remember what PTSD app it was, but the presenter was talking about how actually there was harmful information on this particular app. So any app that you look at, you want to evaluate yourself and make sure that you can safely recommend it. Or if your client tells you that they are using a particular app, that you know enough to say, oh, actually, here are some problems with this, and here's where, you know, this isn't as helpful for therapy. So there's a lot to keep on top of. Before I go off of apps, you know, the one thing I'll add is more and more of my colleagues are getting approached to help developers develop apps. So be wary about who you get invited to help with what. You know, make sure you have a good contract. Talk with other people who've done startups. You know, often the work on building these apps are 50-50 with the therapist and the developer. The developers do a lot of work, but so do the therapist. And it's not so easy translating content from a paper and pencil workbook to an online app. There is a little bit of an art to that. And so that takes a bit to design well. You know, so certainly, you know, those of us who have a lot of experience with knowledge translation are well suited to do some of this work. But, you know, make sure you talk with somebody who can support you. I'm hearing about more and more colleagues who are getting approached to do some of these things, and some of the ways that we have to make sure that we're valued doing this sort of work when we partner up to do this kind of project. But, you know, I think it's really exciting. You know, there's a lot of data that we are able to collect and use. One book that's really kind of influenced my thinking about where we might be going with wearables and apps, and how we might use them in, you know, health and behavioral health, is a book by Kevin Kelly called The Inevitable. And he talks a lot about, you know, how we really need to strengthen privacy rights, and how we all have a right to access our own data, and to know how to tweak things so that we can improve our health and improve our well-being. One of the things that I'm really enjoying, I treated myself to a Peloton at last August, and it was after I read that adherence to it was crazy, that, you know, people weren't just using it as a coat rack. And so I got really curious about what is it that's helping people stick to using this bike instead of it turning into a coat rack. And so there's a number of things, and a lot of it's data. You know, the live classes are kind of nice on it, and kind of fun that there's so many instructors. But there's, and when you're doing a live class, even not a live class, if other people are in the same classes as you can high five them virtually, which is weird. It kind of makes you feel less alone. But the main thing is you actually see your progress. I think that's been the most motivating thing for me. Like I can actually see myself get stronger, and there are changes I might not have noticed if I didn't have this bike that was constantly measuring my performance as I rode. I wouldn't notice that I was getting better. So it's harder to collect some of that behavioral health data. It's one thing to collect it on a bike, and you know, each ride is measured, and you get to see your power ratio and all these other cool stats that I didn't know about before I started riding the bike, because I'm not an athlete. But you know, it'll be really interesting to see the creative things that we come up with in the future. And you know, those of us who can go out and develop those apps that can help us do that, it's just going to completely change cognitive behavioral therapy. We're going to have access to data and be able to tweak it in to help our patients in ways that we've never been able to do before. So I don't know. Maybe I need to do a weekly tech talk about some of the things that I'm really liking that are coming into the future. I think it's very exciting, but right now you do have to be careful about the source of these apps and where they're coming from and what's the science behind them. And to make sure, like a lot of apps sometimes have a Trojan horse connected to them, especially like, not necessarily if they're free, a paid app can do this as well. But you know, sometimes if an app is free for some reason, somebody's collecting data on it or trying to get into your phone for some reason. So be a good consumer of this and read reviews and read about internet safety. Watch the tech talk that I have up on YouTube to go through a little bit more how to evaluate any technology or any platform, just so that you can be a good consumer of the different apps that are out there, because they're growing, and they're really, I think most of my clients are using Headspace or the Calm app. So it's also good to know what, you know, what's the research on those and how helpful they are, and other alternatives and things like that there. So we need to be good users of that data. Okay, any questions there? Is everybody there? Did I lose sound?
Nope, you're still here.
Oh, good.
I think there was a question about consent forms.
Oh, okay.
About where to find the sample consent form.
Where to find a sample consent form. I actually haven't posted the one I use, simply because I think there's like different jurisdictional requirements. And so in the other video, I have a list of things that should be included in the consent form. I think APA did post something, or like a loose template or loose points that you should put in the consent form, but I'll do some digging, and that'll be something that I'll put on Therapy Think Tank. I have in my Therapy Think Tank email, I think I have about 40 people who emailed me in the last week asking for a consent form template. So I might just break down and put one up online, but with lots of caveats that I'm not a lawyer and I didn't have my lawyer write it. So, you know, use with due caution. I don't know. And then I'm going to have to talk to my lawyer about whether I should do that as well. So I have a very conservative lawyer. She's writing the terms of use and everything for the website as well. So that's the other thing. There's lots of things to think about. You know, you just don't throw things up online. So, but when I get the okay, I'm okay sharing what I wrote.
There was another question asking that you spoke a little bit about Microsoft Teams. Can you speak a little bit more about your experience with this platform, the pros and the cons with it?
I don't use it a lot. Do they have Microsoft Teams?
They don't say. They're just wanting to know more about
using Teams. Okay, let me see here. I'm going to. I don't know if he wants to come on camera. If I'm texting my husband who's in the other room. So I think a lot of us, like Teams is actually used to be Skype for Business. So a lot of us know it as Skype for Business. and then Skype. Probably about 4-ish years ago, we were kind of saying, don't use Skype. It's not encrypted. It's not the same thing. And Skype for Business is actually a different technology. Now Skype is the same technology as Skype for Business. So they've increased the encryption. So things have changed there. And then Microsoft Teams, they renamed it, and it's part of Office 365. So it is, and you can get healthcare compliant versions of it. You can get a business associate agreement with it. And the nice thing about Teams is that you can integrate it with so many other things. So again, maybe that would be a good one for my husband, Doug, to do a workshop on, because he uses it for everything. And you know, he can jump on calls. He can easily find a document. It even reads sentiment analysis of your clients' emails to you. It's just, I don't even know all the things that you can do with it. But Teams, from what I understand, works very much like Zoom. It's just embedded into the Office 365 environment. And you can get a version that is healthcare compliant. You know, and they can even store the data in Canada if need be. I don't know if that's like for larger enterprise, like bigger clinics or even hospitals or institutions, that they can agree to have it on the server, but I think they can do it for individual users as well if you have a need. But I'm not 100% sure about that. But yeah, it's like Zoom, but on steroids.
I have a question, Christine, actually, considering I lost my internet for a second time.
Oh no.
Do you have any recommendations for dealing with that in teletherapy?
Oh God, it's been so hard this week because I've been having a lot of connectivity issues, and in this house, because my husband works in tech and I do a lot of stuff like this. We have like extra super high speed internet. So, you know, almost as fast as you can buy, we've bought. So you want to make sure from your end that you have a good internet connection, so that it's not you. One of the things that I've been liking about Zoom is it adjusts the resolution, so I've had less problems on Zoom than I have had on other platforms. I had a lot of trouble with one platform. I could never get it to connect. The app would crash. There's just one problem after another, and they're holding me to my contract, so I'm paying them out for a year. So there's nothing I can do about that. And, you know, and whereas my husband, Doug, was saying, you know, if you had any kind of problem with Microsoft, they probably wouldn't have held you to the contract if you weren't happy. You know, they would have let you go. And, but smaller startup companies, you know, I was involved in a startup where we added video to what we were building. The startup has now died, but as you do when you run out of money, that's another lesson I've learned. But it was actually fairly easy to get the video going. So I didn't think that much about it being problematic, and I wanted to support another Canadian startup. And anyway, I'm feeling a little bitter about that, but it's okay. I'm fine. And then, but Zoom, the nice thing about Zoom is that it does change the resolution. So I've had fewer of those connectivity problems from the other person's point of view. You do have to tell them though to make sure they're sometimes close to their router, or, you know, in Vancouver, there's a lot of concrete apartment buildings, or even concrete houses. So if they're in the wrong room, they're not going to have that connection. Or if they can plug into the wall, you know, like just use their Ethernet and plug in, then you'll get for sure a much better connection. The other thing you might have to tell them is to get other people in the house to not use the Netflix at the same time, not stream other content, or have too many Zoom calls going on at the same time. So I think that's going to be really interesting for a lot of us in quarantine, you know, when there's like maybe two parents working and kids in online school all at the same time. You know, everybody's going to have to bump up their bandwidth, and a lot of the internet companies are removing caps on data usage while people are adjusting and having to work online. So that's good. But removing those caps, it doesn't necessarily increase the speed of your internet. That was something you have to contact your provider and increase the speed of your internet. But yeah, making sure that and this is part of this onboarding piece that adds some time when you're getting so many new clients all at once. It's a different thing when you add a patient or two each week. But you know, if you're adding like 20 in 1 week, talking to them, and this is why I put this in their consent forms too. So my consent form is a little bit more detailed than most because it's also my onboarding document, and for them to refer. But I want them to, you know, have high enough bandwidth, put in some troubleshooting things, like make sure that, you know, no one's using the microwave if you're on Wi-Fi, that you're not using public Wi-Fi, that your router is secure and password protected as well. Newer routers also tend to do more security patches and updates, so that's important as well. If there are connectivity issues, trying to get closer to your router, or, you know, add a booster to it, or put a router in the room where you're going to be doing therapy, or plug the computer into the wall. And then always having phone as backup. So even with these things, with so many people moving online these days, I've had trouble this week, and I rarely have trouble. And you know, just my last session yesterday, no matter what we tried, and the guy on the other end was techie too. We're just like, okay, we're just going to use the phone. The technology is just not working with us. It was just really weird things. And I think it was just like network overload. So phone is backup.
All right. And when do you recommend a consultation with a lawyer for content on websites, for instance?
I think for writing your terms of service. So this is more like when I'm thinking about doing the Therapy Think Tank website, which is like a bigger website, but everybody should have a terms of service and a disclaimer. So you can look on most websites, and actually now we talk about it, I'm not sure I did that for my private practice website, so I should do something. So basically, you know, it's kind of like you use this website at your own risk. It's not in lieu of psychological or medical treatment. And having that is like, it's kind of like the agreement. If you're going to be on this website, this is the agreement that you make doing the website with me. So a lot of lawyers can help you write your terms of service. For most private practice websites, you can probably just tweak, you know, what other people have done, or if there's content that they can share, because it's pretty different than a website where you're selling material, or you're selling a product possibly. But yeah, I'm cautious. I run everything by my lawyer. I've just learned over the years it's not a bad idea to do that. So I'm working on the terms of service with her right now for a Therapy Think Tank. Okay.
So similar thing for YouTube videos, I imagine.
Yeah, I have a little caveat, like this is not, yeah, I talked with a lawyer about that, and psychoeducation. Actually, I even talked it wouldn't hurt to talk to the college again about this, but I was in Alberta when I made them, and chatted with the College of Alberta about the videos. And because nobody was doing it then, you know, it made changes, everybody's doing it, and they're thinking changes about these things too. But he was like, oh no, like, you know, giving a talk, psychoeducation is like writing a book, was the thinking. And you know, if you're giving educating people, then that can be a good thing to do. So, but that being said, I did those videos a while ago, so wouldn't hurt to bring that up again. But yeah, we're allowed to give talks and talk to people and write books and spread the word. You know, more psychologists I really think need to do that, to get people excited and demanding cognitive therapy. And being good consumers of mental health information. I think it's important to share that. And I'm also always dismayed by the stat that, you know, it takes 17 years to get research into practice in most disciplines, including psychology. And so, you know, if we're sharing information and bringing best practice to the public, you know, there's a lot more that we can do. There's just not enough therapists to reach everybody one-on-one. So it's one way that we can contribute and advocate for psychology and for good mental health and behavioral health care. Anything else?
No questions right now. Does anyone else have any questions they would like me to read, or do they want to come on video? All right. I have a couple no's, so much to talk about. And a question is, do you want us to sign our name out at the end to log out? Please do sign your name if you want to get C credits. That way we know that you've listened to the whole webinar. So if you could please do that.
As you're signing out, I just want to also remind you at the bottom, I've added a note. I want to remind you that at the bottom of the email that I sent with the Zoom information is a link to Qualtrics. I've also posted it on here. Since this is our first webinar, first opportunity to try to do this, we'd really, really appreciate your feedback. This will also give you an opportunity to reflect on what you learned today. So please do provide us with some feedback on how this went, what you liked, what you didn't like, so we can improve in the future. And Christine, I'd like to give you a big, big thank you once again for doing this on such short notice. I know I learned a lot. I think it was super informative. I was very happy myself about how smoothly this has all run. So thank you.
Yeah, no, it went really well. And I just want to encourage everyone before we go that, you know, it can feel like a steep learning curve and that there's a lot to put together very quickly. But, you know, you don't have to do it all at once. Do it little by little. Consult with your I think if like there's one message from this, you know, get together in smaller groups and consult with your colleagues. You know, for those of us who are on the CACBT listserv, that's a great resource as well. There's been so many great things shared on there in recent days. And, you know, sharing these kinds of questions and concerns are so important. We're just learning. This is such early days. I mean, I've been doing this for a long time, but I've been like very lonely doing it mostly on myself and finding a few people here and there. So I'm really excited that so many people are going to discover, you know, some of the good things about doing this therapy and some of the things that we can add to our practice that we haven't been able to do before. But you don't have to do it all at once. We can build slowly and support each other and get more and more comfortable with it. And looks like we're going to have a lot of opportunity to practice because it's going to be a while. And so, yeah, keep talking about it and feel free to reach out too if you have any questions.